Hi, I'm Pete Sunwall. I'm one of the third-year residents at Kootenai Clinic Family Medicine Residency here in Coeur d'Alene, Idaho. I remember being exactly in your shoes as a fourth-year medical student interviewing, and you were in a very particular, weird situation now with the pandemic kind of going on where you don't get the great opportunity to actually come here. So we're going to do our best, and hopefully you'll get a good feel of what it's like to kind of come here and hang out in Coeur d'Alene, Idaho with us. This is the main campus of Kootenai Health. It's a 330-bed hospital, and it's where we spend the majority of our time. It's walking distance to our clinic, and there's really only 2 rotations that aren't walking distance to our clinic. Well, we have 2 months in first year where we rotate in Spokane, which is only 30 to 40 minutes away at our pediatric hospital, doing inpatient pediatrics. And then we do rural rotations throughout our time in residency, which is a big focus of our program because we train rural-ready physicians here. This hospital serves the 10 northern counties in Idaho and is a catch net for that area. It's a level 2 trauma center. Kootenai Health is a community-owned, not-for-profit hospital, which is pretty rare these days. There's only about 88 hospitals in the country that are like that. It is a community elective board of trustees that help govern the hospital and that make sure it's run and focused on the community and giving back to the community. And that's a kind of a lot of our vision where we see this residency too, is serving the community that we live in. Okay, we're here at labor and delivery and postpartum, and so go ahead and follow me through here. All right, kind of down this hallway real fast here is our triage area. So we work with a lot of our OB hospitalists. We have a hospitalist program here, which is awesome, and do a lot of OB triage. Let's show you a labor and delivery room. So as you can see, pretty big and spacious, and they are really, really nice. You know, residents get a good amount of experience doing vaginal deliveries. On average, we're about 50 deliveries per resident, with highs up to the 100s to 125 range. We stay pretty busy on this service, but this is the heart of what we try to do, is getting vaginal deliveries. All right, so I'm walking kind of down the L&D unit right now. We're going to kind of approach the nursing station here. Work really closely with the nurses, work really closely with the nurse midwives, as well as our community obstetricians and our own family medicine faculty. We do the triage with the OB hospitalist program, so we have an inpatient laborist here 24/7 as well, and so there's great education that way. And then we also cover our newborn service, which is down in postpartum. We have a NICU here that has up to 12 beds, and we take babies as low as 28 weeks of life. And so great opportunities to learn how to care for the well newborn and to triage and identify when they're needing a higher level of care. So we have a provider dictation room. I don't know if anybody's in here right now. Looks like not. So plenty of workspace to work on labor and delivery. Sometimes that can be very tricky, but it's pretty awesome where we have that opportunity to actually work close and have our own space here. All right, we're gonna walk into our inpatient room where we get really comfortable during our residency time here. All right, we get to see them in their element here. This is the inpatient team currently. We have an attending physician, right now it's Dr. Chambers, and then we have our residency team. Usually there are 2 interns and a senior at any one time. Usually for the entire residency service, there's 4 residents at a time, but usually one of them's covering nights. And so, again, really collegial. It is pretty robust and can be pretty robust, and so it's a good training experience. Just a little bit more about our inpatient medicine. Oh yeah, sorry, I'm in a courtyard here. I just walked out of the inpatient room, and so it's really nice. You can escape again for that and eat lunch out here and then get back to your work, so it's awesome. So a little bit about the inpatient service. It's a 24/7 resident ran service. There are, again, like I said, 3 residents at a time during the day, and then 1 resident at night. And that resident at night covers the inpatient service as well as the OB service as well. We have our own residency faculty who staff it, as well as a private family practice group. We see patients from our own clinic, as well as that private family practice group. And then in addition, we also serve the Native American community just south of us called Kootenai Health. All around just wonderful opportunities to serve all those different patient populations. In addition, as far as teaching, we have EKG rounds that happen every Monday, psychosocial rounds where we meet with the chaplain, our palliative care team, social work, and own a residency psychiatrist. That offers a great variety to our days and make sure we're covering just everything from behavioral health and social aspects. All right, now we're going to walk over to the hospital from the clinic. So this is our wonderful underground tunnel. We're actually going underneath the road right here. It is nice to have this during cold, snowy days. We are in North Idaho, and so snow does happen here. Technically, you don't have to go outside at all from clinic to the hospital and vice versa. This is our outpatient clinic where we see patients throughout our whole 3 years here. It's a very collegial place, and so from day one we feel like a physician, and it's really a breath of fresh air, especially transitioning from medical school to residency. It's a very team-based approach here in a patient-centered medical home where patients feel like they're getting appropriate care from many different angles, mostly from our residents and our faculty, of course, but we have pharmacists here, we have social workers here, and we have chronic care managers here, which is just a wonderful opportunity. We have specialists that are very close to this area and they're a short phone call away. Many times, we need their help and support, and they've always been collegial and wonderful to work with. And so from day one, again, you feel like a physician, and patients treat you like a physician, and the faculty do too. So this is where the patients go when they first come into the clinic. The clinic's built in 3 different pods. We're going to be going to the central pod here, and you can kind of look and see an example of what patients go through and what we go through. So this is an example of a pod that we work in as residents. There are patient rooms throughout, and of course our wonderful medical assistants who are the lifeblood of the residency experience. They're really helpful. Again, it's a very team-based approach, and so again, a very wonderful atmosphere to work in. We see a ton of variety of patients, and so from OB care that can be actually complex OB care, as we have an emerge program here where we focus on medication-assisted therapy, Suboxone therapy to help with moms that become pregnant that have opioid use disorder. And then we see a lot of pediatric care, and it's wonderful because we see them from newborn all the way kind of up, and so I've loved that experience here. It's been awesome. We do see a lot of complex care as well, from advanced care planning, from adolescent care, and so it's a good experience. We do a fair amount of sports medicine and procedures here as well, from dermatologic procedures to joint injections to fracture care, and so it's a wonderful full spectrum family medicine clinic. So this is an example of a procedure room. This is one of our ultrasound machines. We do a lot of point-of-care ultrasound workshops, improve our management and evaluation with that, assisted with joint injections and other point-of-care ultrasound curriculum. We do a fair amount of other procedures here too. Did vasectomies the other day, circumcisions, a fair amount of those, and definitely a lot of dermatologic procedures. We also do a procedure clinic where we have actually our retired general surgeon come over, and we focus a lot on proper technique of excisions, where we go all the way from pretty large lipomas and cysts down to simple mole removals. This is one of our resident offices where we like to hang out after we're done seeing patients. It's really great because we get our own space, which I really like. And so you'll see my space here, my family, pictures of it. People will put plants up, kind of put their own taste to it, which is nice. You'll kind of see here there's a lot of big windows. If it's a clear day, you can see like 3 mountain ranges, which is awesome. One thing I also like is that there are multiple different kind of years in here, so from R1s to R3s, and so again, another collaborative camaraderie that takes place in these rooms where the R3s and R1s kind of learn from each other, and everyone is just so approachable. It's really nice that way. And so an R1 never feels like they can't ask an R3 a question or vice versa, and so we have a lot to learn from each other regardless of the year that we're in. So leaving one of the resident office, we're going to walk over to our shared precepting room here. So this is where we present with the faculty after we're done seeing our patients. Again, very approachable. We ask any questions, whatever help we need for that patient. It's amazing how the faculty really help us put the patient first, but also help us improve our education at the same time. So I've never felt like they push us too hard where we're not learning, or where they don't push us hard enough where we're not learning. So it's a wonderful balance. In addition, we also have a wellness committee where we hold different wellness activities. It's pretty great. We've done yoga in here, kind of a lot of extra, even exercises in here to kind of break up the day. Once a month we'll have residency support group and balance group. We have a psychiatrist that's on our faculty and is a wonderful support kind of to all of us, and he's very approachable with everything he does, and we never feel like we can't talk to him or talk to anybody as part of our wellness curriculum. Another part of our program we definitely focus on that is pretty robust is our behavioral health. We actually have a behavioral health fellowship where we focus on inpatient and outpatient care and managing more of the complex behavioral health patient. So it's a one-year fellowship that happens after we graduate residency. Again, it's open to any resident throughout the country, but it's proven to be a wonderful thing, especially for the community, because mental health is such a big deal and there's just not enough providers there, so it provides a little extra training in there. We have an inpatient psychiatric unit here, as well as a youth psychiatric unit here that fellow rotates in, as well as residents can rotate in as well. We have a behavioral health integration program where our pharmacist will focus on psychopharmacology, a social worker and a psychiatrist from the community that come and talk about certain patients that we've referred to that program, but they meet in our residency, and we are essentially the providers that carry out plans that we have coordinated together. Well, that concludes the end of our hospital tour. I wish I could have talked about everything, but there are many aspects of the residency where I didn't get a chance to talk to. I'm getting ready to graduate here in these next couple months, and gosh, I really loved my time here. It's been wonderful. As I think back of why I chose this program, the community is wonderful, the area is great, it offers a great ability to escape into the community when you're working really hard as a resident. This residency has done a wonderful job in training me. You know, the faculty are quite phenomenal in meeting your individual needs and goals. I feel like I can be a good full spectrum family medicine doc, and it's a lot to this program and to the people part of this program. We feel like colleagues, and we feel like we're friends and close, and we meet together outside the residency and are able to laugh and joke with each other inside while we're at work as well. So a great environment. I feel prepared to go out and to serve the community that I'll be serving in, and to hopefully be a great family medicine provider. And I attribute that to this program.